Thank you, Mr. Chairman and members of the committee. The American Optometric Association, representing over 34,000 doctors of optometry, would like to thank the committee for holding this important hearing. My name is Dr. Rebecca Wartman, and I am the owner of Doctors Vision Center in Asheville, North Carolina. While I've been an optometrist for 21 years, I've been in Asheville for 11 of those years. As an optometrist and a small business owner, I'm pleased to have the opportunity to provide testimony regarding the burdensome requirements established by the Medicare Modernization Act and the chilling effect on providing patient care. Even though CMS has exempted physicians and treating practitioners from the competitive bidding program, under many circumstances, optometrists are still concerned with two requirements of the program, which, if implemented, could have an adverse impact on Medicare patients. First, we believe that requiring physicians and healthcare professionals to be accredited in order to continue supplying DME when treating patients is both financially and administratively burdensome. Second, in the MMA, it appears that there is no recognition that healthcare professionals who supply and educate patients on the appropriate use of DME that is integral to patient care are very different from suppliers who furnish DME products to the public as a primary part of their business. Roughly 14,000 optometrists with DME supplier numbers prescribe lenses, frames, and sometimes contact lenses to patients following cataract surgery, and these items are clearly an integral part of the practice of optometry. These benefits are typically provided only one time after cataract surgery. Further, the 2004 CMS data indicates that healthcare providers supply slightly more than 3% of the total DME. It is unclear, therefore, what, if any, program improvement and cost savings would be realized by imposing these requirements on health professionals who only dispense DME when providing patient treatment. Since March 1st of this year, Medicare began requiring healthcare professionals to become accredited prior to obtaining a National Supplier Clearinghouse number. The accreditation process, as we've already heard, is time-consuming, expensive, and heavy on paperwork, costing up to $3,000 for a 3-year period. Many optometrists, as well as other small business health professionals, do not want to or cannot afford this additional cost and regulatory burden. Apparently, only 4 of the 10 accrediting organizations will accredit optometrists. As well, this accreditation can take months to complete. For optometry, it would essentially be impossible to recoup these costs given the amount of Medicare payments for the small number of DME products furnished to our patients. Therefore, it's difficult to understand why optometrists and other healthcare professionals It's not difficult to understand why optometrists and other healthcare professionals find it impractical to seek accreditation. In fact, the American Optometric Association has already received numerous complaints from optometrists who have made the decision not to supply lenses, frames, and contact lenses after cataract surgery. If optometrists and other healthcare providers are faced with being unable to provide Medicare-covered DME products to their patients at the point of care due to these regulations, the only other alternative would be to refer the patient to a DME retailer supplier. This delay in access to appropriate treatment, or even worse, could prevent the beneficiary from receiving the proper item because there is no DME retailer in close proximity. The cost of transportation, the need for more than one trip in many cases, and the burden of finding a provider will all be serious hurdles for many Medicare beneficiaries. These burdens are even greater for patients in nursing facilities and assisted living situations, whom I personally serve many of those. As well, aphakic patients, those who did not have a lens implant after cataract surgery, are often fitted with contact lenses, and that presents a whole another array of health risks, and the contact lenses do fall under the DME. In conclusion, the one-size-fits-all approach by CMS fails to recognize that DME suppliers comprise a very diverse set of individuals and organizations, including licensed health professionals and physicians such as optometrists. The AOA believes that the accreditation and quality standards developed by CMS should recognize this diversity and be structured accordingly, and we believe that the MMA gives the agency sufficient flexibility to do so. We look forward to working with the House Small Business Committee and CMS to find a way to address these accreditation concerns and to avoid access issues for patients who rely on healthcare professionals to provide DME as a part of their care. Thank you.